Welcome to Let's Talk About It Sunday, an extension of KELA's weekday local talk show featuring a variety of subjects of local interest. This program was pre-recorded, so we're unable to take live calls on today's show. And now, let's talk about it.
Well, welcome to Let's Talk About It Sunday. I'm your host, Peter Abbarno. We're here on KELA AM 1470. Maybe you're listening, live streaming, KELAAM.com. Let's Talk About It Sunday will be followed up by Fox News and Fox News Sunday. And I every Sunday at 7:30 on AM 1470 and then at 11 o'clock on 104.3, the FM channel, the KMNT channel, we bring guests and information about things going on in our community. And I thought a really good show would be having the Lewis County Department of Health and Meja Handlen on the show talking about what's going on with prevention and veteran services, developmental disabilities, and just the things going on in our community that we should all be knowing about. Now that we're, going into summer, let's start talking about how we can improve our quality of life and really start picking up even better habits. It's funny because I probably wouldn't have this show in January because everybody has a New Year's resolution and they're all gung-ho into getting healthy and trying to understand the benefits of eating well or clean water or those types of things. And then all of a sudden, about 3 months later, everyone's off the wagon and back in their bad habits. So Mia's here to talk about what the county's doing to help us learn about healthy living and preventative stuff, as well as very serious issues like suicide prevention, veteran services, and how we're helping developmentally disabled in our community. So with that, Mia, thanks for joining us.
Thank you, Peter. It's very nice to be here.
It's nice to have you. Now, you were on Let's Talk About It before, probably a long time ago.
Yes, a very long time ago.
Before you were director, before you were interim director, back when you were
Developmental Disabilities Coordinator.
Yeah, and that was probably like 2-3 years ago, at least. At least. Well, I'm really happy to have you on. Let's talk a little bit about prevention, because I know that that's something that's really important to you and important to our community. We have groups in Centralia, Morton, and elsewhere that talk about how we can prevent problems from happening, not just dealing with them after they happen.
Yeah, our community, Lewis County in general, is just a beautiful community to live in visually. But what we've noticed is there is a little bit of a gap between what parents are able to take on and also what communities are seeing as a need. So our prevention-based services is called CPWI, or Community Prevention Wellness Initiative. So those are targeted communities, which, as you said, in Centralia and Morton, that provide guidance and leadership on policy changes and programs that help families get together to do really great things. Some of the topics are really fun. Let's talk about healthy eating and healthy lifestyle. Some of them are very, very serious. Youth suicide prevention, preventing kids from even starting drugs of any kind, because we want kids to know there's healthier options. Not everyone is doing it. Actually, more people than they think are not using drugs or alcohol. So that's what the prevention initiative is about. And our coordinators are really embedded in the community. They live there, they work there. They're bringing the schools together, law enforcement, and community leaders to make those changes happen.
I mean, it's an interesting concept, and it kind of just makes sense. I mean, we talk about smoking, we talk about drugs, we talk about a lot of these types of issues, and working with students to show them that you don't have to start. In reality, I think the comment you made that's really important is that it's not the majority of kids who are out on the corner smoking a cigarette, right? Most kids aren't, but there's this perception that it's just pervasive.
Yeah, mainstream media is a difficult beast for us to counter. You see music videos, TikToks, all these things where, it's kids being bad and that looks cool. That is not what's actually happening. We have really great kids, youth, adults in our community that aren't doing drugs, that aren't on the street corners, as you said, smoking or vaping or, just doing crime. But TikTok is kind of the vanity of
right.
our time, because it's showing people how to steal cars. It's showing people how to, make meth. That's not what our community needs. So we are trying to counter that with actually evidence-based projects such as, hey, here's a concept, do a fun run. Also, let's talk about healthy lifestyle, healthy eating within your community, working in small groups on really cool projects like cleaning up a cemetery, things that get you involved and get you engaged face to face, person to person with adults that are great leaders.
Yeah, and Montana just banned TikTok, and I think the state of Washington, we had a bill we tried to too, which is a whole nother show. But it really emphasizes and magnifies the problem with social media and the perceptions that are sent out there. And our kids are so impressionable, and when they see that, it's sad. They want to be like it and they want to mimic it. They think it's cool.
Yeah, there's a lot of money to be made in that though, and that's what's really pushing this, and that's unfortunate. The money is made from sponsorships and big time artists getting those sponsorships. Kids don't understand that. They just see what they think is cool because it's pushed through them, hundreds of times a day when they're looking at each of these social media posts. What they're not seeing is how much money these people are getting for pushing unhealthy lifestyles.
Right. What they should be doing is putting down their phone in TikTok and listening to Let's Talk About It Sunday. That's what I would be doing. So it really important too, vaping. Right? Because vaping wasn't around when we were younger.
No.
It's such a new concept. And now you're hearing about kids thinking, and adults who picked up vaping, now are addicted to the chemicals in the vaping. And also they're getting what's called that popcorn lung or some problem with vaping.
Yeah, vaping is so pervasive because it's so easy to access. Also, it's in flavors like Tutti Frutti. Please don't tell me that an adult is really interested in Tutti Frutti. It is targeted at youth to get them to start it early. It gives much more of a nicotine boost, which is addictive. They are doing it several hundred times a day. The portions of those, the way they can use them in schools or in other locations and kind of sneak them around, that's a huge problem. And popcorn lung, when you're 18, doesn't seem like too big of a deal. As you get older, that progresses into serious, serious health issues, which means you can't live a fulfilling life.
Right. And you brought up probably among the more serious issues, which is with suicide, especially among our youth. I mean, I, in the legislature, was part of the 988 bill and had part of that on for veterans and making sure that they got notified and had the resources for it. A really serious issue. We're seeing it go on. It happened in Centralia not that long ago with a young girl. Really just tragic. So how does this CPWI kind of help out and kind of vetting out some of those issues? Yeah,
the Prevention Wellness Initiative is really focused on things like providing education. So a community mental health first aid. That is a course that they've offered free to anyone to participate in. And then also providing resources like 988. Hey, let's as a group talk about if you know someone who needs that help, where do they call it? Where do they get it? That mental health first aid course, which they offer yearly, is so impactful because it provides an opportunity for anyone to come learn about signs and things that they may not notice, but then will learn to see and learn ways and phrases to use with someone. Because the phrase, back in our day, it was like, is something wrong with you? That's not the same phrase you would use now to a 15-year-old because they're going to say, no, something's wrong with you. That's a microaggression.
Right. Well, yeah. I just answered yes. There's something absolutely is wrong with me. But you're right. I mean, it's a different approach nowadays. I mean, especially for the way parents, and a lot of it's the social media impact that you said, is that parents are and just adults struggle to communicate in the right way with youth who are going through and being influenced by outside sources. Mm-hmm. That weren't available when we were around. Yeah, and they're available 24/7, 365. Recent story in the news about a young man who helped save all the students on his bus because he didn't have a cell phone. All the other students were on a cell phone. He saw the driver having a medical issue, jumped into action. And it was really interesting because it said to me, would you be able to jump into action if you saw a friend in need, if you were face to face with them, had your cell phone down, not paying attention to how many likes you got? You would be able to notice that much quicker instead of being in this shield of social media. Yeah, and I don't know if it makes me angry, sad, disappointed when you see these tragedies happening and they're all recorded by cell phone and you look around in that video and everyone's just videoing a tragedy and they're not helping. It's happening more and more. Yeah, there's kind of a Hawaiian saying, are you a bystander or a saver? So are you watching something happening and doing nothing, or are you getting involved to make a better change?
You are listening to Let's Talk About It Sunday. an extension of KELA's weekday local talk show. Stay tuned. Let's Talk About It Sunday edition will return in a moment.
Okay, and now back to business.
Listen on the air and online.
KELA.
Let's talk about it. Good morning. You're listening to Let's Talk About It Sunday, an extension of KELA's weekday local talk show. This program was pre-recorded, so no live phone calls on today's show.
And if you're just tuning in to Let's Talk About It, AM 1470, KELA or KELAAM.com, or maybe on KMNT 104.3, this is Let's Talk About It Sunday with your host, Peter Abbarno. Meja Handlen's here with the Department of Health here in Lewis County, and we're talking about prevention, and we're talking about all the things that the county is leading the way and helping kind of trailblaze in our community to help our community members live healthier lives. And prevention is one of them. And the one issue that you mentioned that I think is also really important is veteran services. There's been, especially recently when some veterans offices had been moved out of Lewis County and up north. And that was a big deal. And we had a number of shows. I had Heidi Palmer on the show as well, discussing that. Talk about some of those veteran services, because I know there's been some new partnerships that the county has created.
Yeah, it's been actually great to have the Veterans Memorial Museum want to take on some of, it's not a burden, but an honor to serve veterans. Our veteran service officer, Heidi Palmer, is one person to try to serve this large geographic county, to provide, benefits to widows, to provide food vouchers for those veterans who need it, also to get them connected and with their claim so they can get the services that they are entitled to. So Veterans Memorial Museum and Lewis County Public Health working in conjunction to make sure there's another veteran service officer, at least one. Chip at the Veterans Memorial Museum has been great. He has a big plan about getting more veteran services officers in the community, but as it stands now, we are on slate to have another veteran service officer available who will be traveling to the East End, to the South County, to ensure that we can meet them where they are and that the veterans don't feel othered. And when I say othered, that's a really important thing with veterans. So veterans in the Vietnam arena have felt othered since they returned home. Those who were in, the Middle East more recently have felt othered. They don't know how to access services, or they're very proud and don't want to ask for services. So to have someone housed at a location scheduled where, hey, walk on in, come in, talk to me, let's just see what services you might need, that opens the door to provide somebody who served our country with what they're entitled to.
Well, and it also is important in our community because when I was working on some legislation for veterans employment, I was doing some research, and Lewis County, for instance, has a much higher population of veterans per average than other counties in the state of Washington. So it's on the higher end. So there's a lot of need out there. And in a county that's more rural like ours, that even compounds the needs of our veterans and their families.
Yeah, one big service that we provide, and it has been really impactful, is transportation. Since the medical office left, the lovely Hampy Way in Chehalis, 4 hours one way to get to services. That's not okay. 4 hours one way, if you don't have transportation, isn't a thing. That's like disgusting.
Right.
So to have a door-to-door service for that veteran so they can get the appointments they need in a timely manner, that is a great service that we provide through the Veterans Benefit Relief Fund. And
that's it's interesting because a lot of people still don't know that the county plays a pretty major role in that. And it's transportation, there's food. I think it's also got some rental vouchers as well for folks struggling for rent. But I agree with you. One of the most impactful services that are provided is Heidi helping to help veterans navigate the federal side. I mean, I've as an attorney, I've had clients who are veterans, and I sit there and I look cross-eyed trying to figure out how to navigate this system. And she does a very good job helping them get those services. So she meshes the county with the state and the federal.
Yeah, and we are really excited about that because her lived experience, being a veteran herself, she speaks the language. She also understands the legal part, and here's what we need to file, and here's the timeline to do it. So the veteran service officer that's going to be onboarded through the Veterans Memorial Museum is the wife of a veteran. Okay. So she knows that as well, is very comfortable with that, the language they use, and just will be a really great asset for us.
Yeah. And if you're just tuning into Let's Talk About It, AM 1470 KELA, or maybe you're streaming at KELAAM.com, or maybe KMNT, I've got Meja Handlen on with the Lewis County Department of Health, and we're talking about prevention, veteran services, and we're going to transition into something that we have a love of, which is developmental disability services and support. You were talking before the show, we were talking about Senator Braun and what a leader he has been on this. Being in the legislature, it's been great to watch him and to kind of help with some of these issues, but he's been a real leader on developmental disability issues.
Yeah, he just in the last legislative session moved forward a bill that would actually pay providers a wage that is more compensatable for the services that they're providing. And actually, the only county commissioner who spoke at that Senate hearing was Sean Swope.
Yeah.
He took the time because he feels in his heart that that is important for persons with developmental disabilities to have access to employment and day services. That's a huge thing. And we did get recognized by ACHS. Oh, only one county commissioner came and spoke at that. Yeah, and it was ours.
Yeah.
So that was really great because in cohort with Senator Braun, understanding that that need is there and that this is a population that has so much to offer.
Yeah.
And this is what we need to do. Also, a new program that is coming on board is the readiness to work. So high school age students, getting them those tools that they need so they can be gainfully employed at graduation. Some people don't think about that. It's just a given. You're going to get a job when you graduate. A person with a developmental disability or their parents may not understand how important it is to have that benchmark in their life. So a service to lead them through interviewing so they can job shadow, maybe come to a radio station, see what that takes, how that works. So when they do graduate, having meaningful employment, that changes a life. That really does.
Well, and some programs of the past have just been, to an extent, dehumanizing, right? Because there's no expectation of happiness or success. It's here's your lot in life and you are stuck in it. What I like about recent changes is the idea that we need to create communities that are really, truly inclusive for folks who maybe don't always look like us, maybe don't always act like us, maybe have physical or developmental disabilities, and make sure everyone has a good quality of life. And it seems, and I know it is true, that the county has taken a really major role in making sure that we hit those benchmarks.
Yeah, Washington is number one in employment services, which is really great. Lewis County is number one in heart.
Yeah.
Meaning we have, a developmental disabilities coordinator, Sarah Sun, takes her own time to be a coach for Special Olympics, is really involved and really understanding the parent's perspective, but also the provider perspective and how that trickles down to the individual who their goal is to be part of the community because they love their community.
Yeah. And Sarah and her husband are great because we're involved in Special Olympics. It's one of my great passions to be part of the polar plunge team and to be part of the torch run with the law enforcement. They're always out there. They're always supporting. They're coaching. And one of the greatest things that Sarah said at the polar plunge is when we hit our mark for raising money, she said she had a mom who's also a coach call her and say, I saw how much money you raised. And she said, yeah, you can order uniforms. I mean, it's very touching because otherwise they wouldn't have uniforms or travel expenses and all these things. It just comes down to the fact that you're right. You hit the nail on the head. If there's one thing Lewis County has, it's a huge heart.
Mm-hmm. It's people who care and understand that impact of when you put on a T-shirt for a team, you are part of that team.
Yeah.
So the money raised by jumping in icy water or running a lot of miles like a gazelle through the city streets, it impacts our local residents. And also that shows them the community cares. That makes them want to participate in other community events.
Yeah. I mean, it makes you want to be part of something, but in reality, it just feels good to know that you're helping change the lives of people, even one uniform at a time. Because I know how bad I would feel if I was part of a team and we couldn't raise money to travel, for my parents to come with us, to have a uniform. And it's great to see our community come together and be able to provide that. So it's good. And I'm glad to hear that Sean Swope showed up. I mean, it's important to hear from our local community leaders and just our local community, period.
Yeah, it is. It's a big thing we always talk about local voice is important.
Yeah.
Local voice being shared in other arenas is extremely important. We're not just little Lewis County. We're Lewis County who cares, and we want what's best for our community.
Well, and you even said that before the show when you and I were talking off air, CPWI. Part of CPWI is making sure, and this prevention is making sure you hear voices from all different sides, because you want to know what your community's thinking. You want to hear from them, and you want to know what their value system is, because it's important. If you try to stuff something into someone's community and it doesn't meet their value system, it's not going to work. You're going to meet resistance.
Yeah, and that's not what community is.
Right.
Community isn't about just one single idea or concept. It's about how do you get the best from everyone and put that forward for kids to thrive. We should be talking about the next generation and the next generation. That's what prevention is. We do spend a lot of time everywhere, federal and state, about let's be punitive, people who've already created crimes or done bad things. Community building and capacity talks about the next generation. How are we supporting them so they don't feel the need to do drugs to feel okay?
Well, it's the old adage about ending intergenerational poverty, right?
Yes.
When you're teaching parents how to parent sometimes, right? And you're teaching kids that there's the new habits, whether it's eating, not smoking, right? Even just counseling to learn that you don't have to follow TikTok. You could have your own self-esteem and you could actually live your own life and blaze your own path. That ends intergenerational poverty. At least it gives the opportunity to do it.
Oh, it's evidence-based, Peter. That does end intergenerational poverty, because study after study has shown that engagement with families who understand their role as parents and grandparents and aunts and uncles being involved in a child's life, it's a game changer, and it makes that child feel valued, appreciated, and worth.
Yeah. And it's got to start early.
It does.
I just had the United Ways of the Pacific Northwest on, and we were talking about Dolly Parton Imagination Library. We were talking about early learning. And 95% of a child's brain is developed by the age of 5. So starting habits about reading and eating well is all early learning stuff. You have to start early.
Yeah. And that's another really cool program we have, the Birth to 3. And that's what that's about. It's helping families who've just gotten a diagnosis for a child with a developmental disability, how to navigate that system, but also how to meet other parents, how to work with what they're feeling and going through. So that child, birth to 3, man, formative years, right?
Yeah.
How you're interacting, what is next for your child. You need experts there and also peers there who can show you the ropes and show you you're not alone, but also you can see other kids who are at age 2 when your child is, say 5 months, but at age 2, look at that little guy go.
Yeah.
This is inspiring, and there's hope. That early intervention, you cannot speak more about. So the early education center that's coming, InTaught, Head Start, things that get kids involved early and the parents to see those changes and for the parents to learn from one another, huge.
Yeah. Well, I mean, we're about 21 or 22 minutes into the show, and we finally use the word hope, right? and that's something that we probably should have said in the first 22 seconds, because all of these programs are about showing hope, showing success, providing hope, giving people options and hope, because without hope, people have nothing. If you don't think there's something brighter on the other side, then you don't try.
Yeah. If you don't see success or know what success is, you give up.
Right.
And healthy eating, healthy water, a veteran knowing that there's somebody else out there to talk to. That is hope, and hope inspires and sparks to motivate people.
Yeah. And I feel like you mentioned water as a cue that we're going to talk about clean water, water quality, well safety, because that's another really important thing that folks sometimes forget about. Would you say to me before the show, you are what you drink, or your water or something, and it's true. One, people should drink more water, but knowing that you have clean water is super important.
Yeah, potable water. We, might have heard that term in high school. What does that mean? Potable water is what you can drink and ingest. And we have a lot of rivers and lakes in our beautiful community. What we don't have a lot of is opportunity for people to understand what it means to have healthy water. So we're pretty lucky. We had Sue Kennedy for decades in our health department as our water specialist. She recently retired. We were a little nervous about that retirement because we jokingly called her the water goddess. Some people loved her, some people hated her. What she cared about was the health and safety of the water systems in our community. Well, we got Jeff Landrum, who's a hydrogeologist. He onboarded. He has been fantastic. And he loves educating people about, okay, we do have a single aquifer. So what does that mean? If you're trying to tap into this or, working with Mike Handlen, who does on-site septic and community development, how is that going to impact the neighbor, the system?
Right.
That's so important as development's a big deal in our community.
Yep.
It's got to work hand in glove with capacity. So infrastructure, water, sewer, septic, we need that to be clean and well run.
And again, if you do not have clean water, and live on a critical aquifer, if you don't have clean water, your community is going to spend 50, 60, 70, 80, maybe more $1 million trying to build a water treatment plant. Why do that when you can create preventative measures like sewers and getting people off septic to ensure that water stays clean? That's so important.
Yeah, septic's a viable option in some areas and some instances, just like a well is a viable option.
Yep.
But the more people that move in and start tapping into those things, that creates capacity issues.
Well, and wells and septics are fine, but you got to test them. You got to make sure they don't fail. I mean, it's important to make sure if you do that you keep your water clean. It's funny watching TV late at night. You'll see all these ads about clean water in third world countries. Sometimes we forget, even within our own community, there's been boil notices all over the country, even in our own community before for contaminated water.
Yeah, that was one thing that Sue really shined in during the 2007 floods. That water table went up really high. People's safe drinking water was in jeopardy. She went out and educated and informed people, hey, let's go ahead and do some testing. Let's figure out if this is potable, if this is good for you, and the boil orders. Nobody likes getting that, but if you're, on a system and there's an issue, that boil order is really, really important because your health and safety are in jeopardy. And that's what our staff do. We want to inform and educate so people can be healthy.
Well, we appreciate you informing and educating us. And I appreciate you coming on the show and sharing all this amazing information. Meja Handlen with the Department of Health in Lewis County, thank you again for showing up. And I guarantee this is going to be one of those where people are going to call in and say, hey, we want to have her back because there's so much more information we want. So I hope you come back.
I would be happy to. And thank you for your longstanding support of everything we do, Special Olympics. June 2nd. Happy to see you out there.
My knees will be swollen from the long torch run. I think it's longer than usual, but I'll be there. Thanks for listening to Let's Talk About it, AM 1470 KELA and KELAAM.com.